Obstructive sleep apnea is a common sleep disorder characterised by pauses in breathing or shallow breaths during sleep. It occurs when the muscles in the back of the throat fail to keep the airway open during sleep despite the effort to breathe. As a result, the airway becomes partially or completely blocked. These pauses can last for a few seconds to several minutes and can occur multiple times throughout the night, disrupting the quality of sleep and leading to symptoms such as loud snoring, gasping or choking during sleep, and excessive daytime sleepiness. Sleep apnea can affect individuals of any age, but it is more common in those who are overweight, have a family history of the condition, or have certain anatomical features that narrow the airway, such as a large tongue, tonsils, or a small jaw. Other risk factors include smoking, alcohol use, and certain medications. Untreated sleep apnea can lead to a variety of health problems, including high blood pressure, stroke, heart disease, diabetes, depression, and cognitive impairment. All patients are screened for sleep apnea during their preoperative assessment process. If left untreated, sleep apnea can be dangerous after surgery because the medications used during anaesthesia can make the muscles in the throat and the tongue relax even more than they would do during sleep. This leads to a greater risk of airway obstruction and breathing difficulties. During your preoperative assessment, your risk of underlying sleep apnea will be assessed. If your risk is high, it is likely you will need to undergo formal sleep studies to confirm the diagnosis. Once confirmed, most people will need to be issued with a CPAP machine to improve breathing during sleep. Once you're established on this, surgery can be safely undertaken, and most hospitals will happily care for you in a normal ward so long as you are using your CPAP machine. An alternative approach would be to nurse you in a high dependency unit bed post-operatively, which would normally result in additional costs. If you are already established on a CPAP machine, it's really important to make sure that you bring this into the hospital so it can be used during your stay whilst you sleep.